Hey there, welcome back to the channel. This is Dr. Amber, and today we're going to talk all about sarcotropin, a peptide that does not have to be injected. Today, you do not want to miss this episode if you are somebody who's really interested, curious, passionate about peptide therapy or utilizing peptides for improving health conditions, anti-aging, longevity, deep sleep. But maybe you are very needle phobic and you don't like the injectable part of it. We're going to talk about a peptide that is not an injectable, but can really support longevity, muscle mass, weight loss, as well as so many other things. So stay tuned. The peptide we're going to talk about today is called Sarcotropin IPA, and it's technically a medical food that's designed to manage sarcopenia, which is the loss of muscle mass as we age, right? And all of us will experience sarcopenia, especially after the age of 30. We start to lose muscle mass and strength. And so if we're not weight training and really repairing that muscle through dietary means, we're going to be losing that muscle mass. And so Sarcotropin IPA really helps not only with a lean muscle mass, it can help with fat loss goals as well. If we break down that word in Latin, because all of the medical terminology is in Latin, sarco is the word that means flesh or muscle. And so sarcopenia refers to the loss of muscle tissue, penia meaning loss of. Sarcotropin means the muscle tissue, but the stimulation of, or the regulation of. The IPA after sarcotropin stands for investigational peptide agent. So technically, sarcotropin is not a medication. You can get a prescription for it through a practitioner, through a doctor, but it is actually formulated as a peptide-based supplement. The primary active ingredients in Sarcotropin IPA is it's really a blend of peptides, very similar to CJC ipamorelin. It does contain ipamorelin, the sarcotropin blend. And ipamorelin is that growth hormone releasing peptide, or GHRP, that stimulates the pituitary gland in the brain to release growth hormone. And that can improve lean muscle mass, strength, just maintaining that life force of muscle mass. I really like Dr. Gabrielle Lyon, who has a podcast and talks all about how muscle is medicine, and our muscle really allows us to have better glucose response, right? When we eat a big meal or we eat carbohydrates, our muscles, the more muscle mass we have, the more we'll uptake that glucose, and the better our blood sugar regulation can be, the less that we're going to store that food as fat. So we have ipamorelin, and then we have other GHRPs, other peptides in there to enhance that growth hormone response to build lean muscle mass ultimately. What are the benefits of Sarcotropin IPA? Well, really, there's several benefits. We talked about the lean muscle mass is a big one, but also improvement in physical strength and performance in weight training. It can also aid in the reduction of body fat, improving sleep quality, and then just enhancing overall quality of life, because if you're sleeping deeper and you have more energy during the day for workouts and exercise, you're going to be feeling better as well. It's important that this should only be used really under the guidance of a healthcare provider, even though it is technically a medical food or a supplement, peptide supplement that can be accessed really by anyone. But there are some potential interactions with medications, other supplements, and certain health conditions that you do not want to take this sarcotropin if you have. So contraindicated in these following conditions: chronic GI distress associated with abdominal pain or diarrhea, right? So somebody has a lot of GI issues, pancreatitis, active malignancy, so anybody who has current cancer, and then type 2 diabetes. So contraindicated in those. Some of the other benefits of Sarcotropin IPA are, we talked about muscle mass, accelerated healing, right? So if you have any joints or areas that are injured, right, it can help with that repair process. Skin abrasions, it can really help with repairing there. We talked about sleep quality. That's the biggest thing that I noticed with a lot of these growth hormone releasing peptides, growth hormone releasing hormone options. So CJC, ipamorelin, that combo really, really helps with deep sleep and restorative sleep. And so sleep is really how we slow that aging process, as well as easier weight control, right? It can help with satiety. And then the lean muscle mass, we increase the calories burned at rest. So it's going to be easier to control weight because of that. Some people do notice an improvement in libido or sex drive. And so that's another thing that could really be valuable too as you age. And then better cognitive function. So again, if we're sleeping deeper, we're going to feel better during the day, but sarcotropin can really improve that cognitive function. And so you can focus better on tasks and accomplish more. So this is sarcotropin. You can see it's a medical food. It targets the muscle, the brain, and the pituitary, right? And so that's how it works. Helps with injury, illness, helps you feel strong and remain active. And it's definitely an option, I'd say, more 50 plus. You know, it could be used in somebody younger, but typically after the age of 50 is where we really want to start curtailing that muscle loss and adding in something supportive here. So again, by age 30, we can see weight gain and the effects of muscle loss, right? That skinny fat, if you've heard that term before, where we don't have a lot of muscle, but we have more fat accumulation. And then of course, after 40, we see even more so. So really it talks about how this is a medical food. It's really indicated for aging. It's essentially a way to take ipamorelin without injecting it, right? It comes in a liquid form. And you just take a small amount by mouth daily in the morning, can be done at night as well, to help with the lean muscle mass. And so it's intended to oppose those deficiencies by combining that healthy diet, lifestyle, improving energy so that you do have the energy to remain active. And this is really exciting. There was a large 90-day phase 3 clinical trial that was conducted to confirm the safety and efficacy in humans. And it really did demonstrate loss of total body fat, loss of visceral fat, that gain in lean muscle mass, and then increase in IGF-1. And this is so exciting for women 50 plus, all of my menopausal, perimenopausal women, because they tend to really struggle with weight gain after 50. Part of that is the loss of muscle mass, but also the decrease in these hormones, including that growth hormone. This last weekend, I went to A4M, the Academy of Anti-Aging Medicine, and it's a conference with so many doctors from around the world that are all excited about slowing aging and protecting your health and improving quality of life for their patients and for themselves. And you know, there's a lot of talk about growth hormone and IGF-1, among so many other things as well. Diet, nutrition, vitamin D, so many great talks by practitioners, but there's a great talk, growth hormone. And so we're seeing a lot of the benefits here with sarcotropin. And then again, here's the ingredients. You have GHRP2, vitamin D, ghrelin, which is one of those hunger hormones, right, that regulates appetite. And then macunapirians, which is an herb that helps with the production of dopamine in the brain. So sometimes the cravings that you have in the evening where you maybe crave sugar or carbohydrates, it can be from not having enough protein earlier on in the day, right? So lack of protein in the diet can cause more of those cravings because we're not getting that minimum daily threshold of protein, but also it could be low dopamine for many people. So low dopamine could cause some of those cravings. Dopamine is that drive and motivation hormone, and macunapirians is a really good herb to boost dopamine levels. There's a few different pharmacies that offer this. You'll see Prosoma Corp is one place to get it. I like getting it through Belmar Pharmacy as a practitioner, right? So that's another place to look. You really want to find a practitioner who knows about this, who knows how to use it, who knows when to use it, when not to use it, and then how to dose it, how to take it. So that is sarcotropin. Let me know if you have any questions about this peptide. If you're curious in trying it, that's something that we do offer. But of course, right, you want to use it under medical supervision. Thanks so much for tuning into the channel. Let me know if you've heard of sarcotropin. If not, hopefully this was helpful and new information to you. And let me know any other topics that you'd love to learn about as far as peptides for deep sleep, peptides for fertility, different options to improve brain function. Happy to cover any of those topics that you're interested in learning about. And it's so much fun connecting with people all over the world. Thanks for tuning into the channel, and I hope this was helpful. We'll see you in the next video.